recording, and I'm going to mute my mic.
Hi, my name is Carroll Golden, and I am the Executive Director of the NAFA Limited and Extended Care Planning Center. You know, COVID-19 was really a wake-up call for all of us. We learned in our families that we're not really prepared for any kind of extended care. Actually, the cities, the states, the counties, we all learned pretty ill prepared. So on a personal level, what we did see with COVID-19 is that it interrupted our day-to-day routines, that our employment and savings were impacted, our work environments certainly were impacted, and access to us giving our family any kind of care and caregiving was definitely interrupted. So today, what I'd like to do is help you design a program for caregiving that you design personally for your family. One of the things that COVID-19 told us was that when the pandemic goes away, we still have this topic of caregiving. And why do we have it? Well, because frankly, longevity, which is a blessing, also comes with the need for caregiving, whether it's aunts, uncles, grandparents, parents. It doesn't really matter. It's just that all of us, because of medicines and our lifestyles, are starting to live a lot longer. But as that happens, we quite often enter into stages of needing care. So for your family, here we go. Who would be the caregiver? Usually it's in our lingo in financial services, we call it an alpha child. But actually it's the head decision maker. And that decision maker is best served by forming a care group, a core group who is going to help them as we go through our planning together. And then you also need a care squad because one person can easily get overwhelmed. So we're also going to look at forming a caring squad. Longevity, as this shows us from this US Census, is something that is definitely going to require caregiving. As you noticed previously, there weren't that many people making it into their, say, beyond 65 age group. And look at the difference that we're projecting now. So you're probably best served by recognizing that caregiving is a lifespan issue. Today, there are fewer people in our families to be helping with these chores. Also, so many of us live quite a distance, or families that have separated because of work, because of marriage. So there are fewer family members to provide care. And defining families, well, some of them, because of remarriage, have two sets of in-laws in some cases because they're still grandparents to the children. Also, there's a growing distance in the ability to get to everybody. Yes, we need a plan. So let's take a look at who's today's caregivers. Are you part of the 54% of caregivers who are employed, full or part-time? Are you going to be part of the statistic that we see on the screen of 58% who still have a child at home? Which of the categories would you be falling into if you had to become the caregiver? You know, life is like an echo. What you send out comes back. So now let's get into recognizing in your family, what kind of family is it and what kind of complexities are in that family? Who would be the alpha child? Now be careful because sometimes selecting the alpha child or the decision maker, there could be issues in the family about who that should be. Best to do it when you're not all under a lot of stress like we are with COVID-19. And then you need to form your care squad. You're going to need people of different ages in your family because there's different things that need to be done. You know, we're used to hearing that we're part of a sandwich generation, but I think I'm comfortable saying that we're all starting to be part of more of a club sandwich with grandparents, parents, children, ourselves. It's gotten complex. So today I'd like to do a case study, and we're going to use this family, and we're going to have Annie, who is the matriarch of the family. And we're going to deal with what's involved in creating a plan for Annie's parents. Now, whatever we do for that plan, Annie knows she's going to have to do for herself. And even her two daughters that we see here, Joan and Nicolette, who also have children. It's best to know that planning is generational, and that's the way it is best done. So, how do we start? Well, to begin with, you have to start the conversation, obviously. And you have to decide for that conversation who should be in the initial party. Who's going to be part of the core group? Not everybody handles the whole topic of caregiving with great ease. You don't want to be upsetting family members, so sometimes it's better to choose your core group with people who can really help in different ways. As we'll see, there's a lot to be filled in here. So who's going to speak to the advisors, maybe the doctors, maybe even the person who is needing care? It's good to know so that as you move into doing what are the possible scenarios in your family, they don't look dreadful. You're not talking about end of life all the time. You're talking about a process. And look at what could be done that would be helpful. As you can see on this, you're going to want to determine the current health, but it's important if somebody goes to the hospital or needs care to know what were the previous illnesses. Did they have operations? Do you have a list of their prescriptions or their savings, their documents? So let's do this for our case study. Annie's parents, Helen and Joseph, present the most immediate need. And as I said, the rest of the family probably needs to do this as well. But Annie's father, Joseph, is in good health, but he does have a pacemaker. Her mother, Annie, she's more frail and she's not as steady on her feet. They both have Medicare policies and med subs. Helen is dependent upon her husband, both financially, for moral support, and unfortunately, for some physical support. Helen is always looking to Joseph, and that can have an impact on Joseph. Because Joseph is now no longer really able to do all the chores around the house, the garden. So he hires teenagers who come in and give him a hand. Joseph collects Social Security, as does his wife. And in terms of family history, and this is important, Joseph has family history where there's a heart history. Remember, he's the one with the pacemaker. Whereas Annie has longevity on her side. Her sister is actually older than her and living in a CCRC, which is a community care. Joseph has $100,000 of insurance, Annie none. And they have a will that they drew up 30 years ago, and they updated it 15 years ago. So now they both want to stay in their house. It's important to both of them that they be able to stay in their house. So your core group can say, what is it going to take to help them? Well, as you can see from the list, there's lots of technology now, fairly simple technology that's going to allow them to stay in. One of the things that COVID-19 really brought to the fore is telemedicine. So now you say to yourself, well, instead of having Annie have to take time off from work to drive them to the doctors, she can have telemedicine done. And then the doctor will let her know if they need to come to the office or to the hospital. Also, there's doctors and nurses who, I think when COVID-19 passes, will be making house calls. And Some of the other events that we see happening are that, for example, CVS has health services in its stores, and Walgreens is transferring some of its neighboring centers into more technology-based healthcare and a nurse on board. The home delivery of prescriptions certainly got a boost with COVID-19. But here's a wrinkle. Annie is afraid of having their prescriptions delivered. Why? She's afraid she'll get the wrong one and take it in a moment. She feels very confused about whether this is safe or not. So not all of these supports are going to work. Now, as they become more dependent, and as I said, whether it's Annie or whether it is her parents or an aunt and uncle, they're going to need training, and very few caregivers get the kind of training that they need, because if you have to help someone bathe or get out of bed, you don't want to injure yourself. So you'll see that there's education, there's nutrition, there's transportation. Again, probably you're working. And if you can use some of these community services, it would help. So Annie, the core group, and the care squad are all looking into different aspects of what do they do? Meals on Wheels, is that the right way to go when Annie's mom, Helen, is not really able to do as much cooking? So what's the basic plan? So Joseph and Helen, who want to age in place, they feel they're too elderly to make a lot of new friends, and you can see they have some hesitancy about technology. In order for them to stay in place with their limited income, they're looking at different options. For one, all the advances that have been made in reverse mortgages. Joseph does have a life insurance policy, and it could be used for life settlements, except he wants to leave it to his family. And they could consider spending down and qualifying for Medicare. Problem with that, Annie and the rest of the care squad, they don't want decisions for their parents made by a government program. So they do get an advisor, and they do look at what would be a reverse mortgage. They wouldn't have to dip into their savings. They were amazed at how many different options there are for reverse mortgages. And they made sure that the house couldn't be taken if they paid the taxes, maintained the house, and were very careful to make sure that they paid the little bit of a mortgage that they had left. Well, they're moving along nicely. They're starting to get their things together, and they're talking about, you know, what would it be like to have a come and go caregiver? Maybe they could use a little of the money from the home equity loan to pay a part-time caregiver to help with things like showers. And then the unexpected happens. Joseph, who has a pacemaker, starts to feel faint, and Helen, his wife, tries to break his fall. Unfortunately, Helen, who wasn't ever really steady on her feet, she's the one that takes the tumble. And as a result of that, Annie's, who's visiting with her daughter, now has her daughter and herself. Her daughter has to call for an ambulance because both of the grandparents need to go to the hospital. Now is time to get their core group together to let them know that they have moved from the planning into a stage of changed planning. Will they need a physical therapist? Who's going to fill out the paperwork for the Medicare and the Medicaid? Who's going to make sure that they can pay the bills? Because this is a large family, but they don't have a lot of extra considering how generationally they're packed in there. So what had they done in preparation? And this is what you need to do. As you can see, we've listed some basic questionnaires for you to use. If you fill out these questionnaires, and at the center we do have the questionnaires, work with your advisor and find out what kind of communication you need. How do you set that up? We know that the legal documents that Helen and Joseph had were 15 years old, and they don't have health directives. So nowadays, because of COVID-19, many of the health directives don't address innovation. And if that was the case, could be a problem. So what are you seeing here? Get prepared and get documents safe in a place where you know that they are. One of the things that you should include in your plan is called a grab bag. In times like this, you need to have something ready to go with the insurance card, with documents that allow you to make decisions, that are updated so that if something happens, you're empowered to do things. So these questionnaires, they're easier to do while everybody is healthy, while there still is COVID-19, everyone's closed in. Maybe your core group, each of you take a different thing. If you find out about family history for Helen, for Joseph, that helps you as Annie's child to be able to know what her parents' medical history is and their family history. I hope that this has set you in a direction that you realize how important planning for extended or long-term care is. And I hope that you will take this as okay, let's get organized. Let's do this. Well, thank you for your time. Stay safe and stay well.